There was nothing. And so I was really flying by the seat of my pants, taking my adult knowledge, my OBGYN. Thank God I did a rotating internship. That's all I can say. Because I took back pain, scoliosis came from my orthopedics, all of that stuff. And I began to integrate it into the care of the adolescent. Anyway, so here I'm going along and doing as best I could with this, but not really living too risky of a life until one night, you know, in my day, you know, we used to work 48 hours straight, you know, no ACGME to get you off at noontime. And, you know, I was on for 48 hours straight, and I was going home. It was about 9 o'clock at night. It was a cold night. It was Montreal. Wind was blowing. Hospital's at the top of the hill. And so the nice thing about the hospital was two things we used to always say. When the drunks came in on Saturday night, you know, if there's nothing wrong with them, we'd shoot them up with caffeine, stand up at the top of the hill, and give them a push. Down the hill they would go. You know? They couldn't stop. And the other thing, when you work 48 hours, all you had to do is just keep one foot in front of the other, and you get home. Down the hill you'd go. So here I was going down the hill, and the wind was blowing, and the sidewalk was slipping. I lived about 10 minutes from the hospital. I got to the bottom of the hill, made a left turn down the street I lived in. My head was down. Of course, we were all dressed up in little whites and you know, page boy outfits and white bucks and everything. And I'm walking along, and I got my parka up, and my head's hidden. All I could see is my bed, like this. And then this guy comes up to me, this young kid comes up to me, and he says, "Are you a doctor?" And I said, "Yeah." Trying to get away from it all. And he said, "Well," he says, "we've started a clinic for young people just down the street in one of the apartments. And we have a girl in there. She's our first patient, and she's bleeding from her vagina. Can you come and see her?" And I said, "No, I can't." But when I said that, no, I felt guilty. My bed, that's all I wanted was my bed. And he said, "You sure?" He says, "We don't know any other doctor around." I said, "Well, okay." So I went over to see her, and she was having an incomplete, and it was my diagnosis. She was passing tissue. And so I just called up to the hospital. I knew all the residents. I knew there'll be a resident on call, the GYN resident on call. And I just called them and blah, 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 blah. And I said, "Take her up to the hospital. She'll be taken care of." Well, I guess they were so impressed, that he was so impressed with the service I gave him, that, you know, now I've gotten to my bed. I'm in bed. It's now probably 8 o'clock in the morning, and I hear on the door in my apartment. What's that? Very persistent. And I thought, if I just wait long enough, it'll go away. It didn't go away. Kept back. So I opened the door. And I'm sleepy, and it's this young, long-haired hippie again. And I thought I was going to get a report on the girl, which I got, the report on the girl. But then he says, "We were really impressed." We, him. There was only one person with him. "We were really impressed last night with how you handled that young lady, that we have decided that you're going to be our medical director." So I said, "Hold it, do I have a say in this?" And he said, "Well, we really like you." So anyway, I ended up being the medical director of the first free clinic in Canada.
In a basement?
In a basement apartment of a building that was scheduled to be demolished or reconverted into condominiums in a sort of a student part of town. And I started going down there at night, and you have to remember, I've got the experience of the emergency room of the hospital. I'm a resident who doesn't have much credibility in terms of being faculty or anything like that. I had no faculty advisor. What I did have was that every time I saw somebody who had a problem, I would write it down and I'd put it in my pocket, and then to look that up to see what it was all about. You know, the drug, if they came in with, you know, at the time it was LSD, I would write down LSD, put it in my pocket, and find out what LSD was, and blah, blah, blah. So I went into this clinic as the medical director with a pocket full of little chits of paper with problems written on it, not many answers, but a lot of problems written on them. And I started going down there like 2 nights a week. The 2 nights I had off, I would go down there and work in this clinic. And again, the context of this is that this is in a very suspicious environment. And going down there, I became, you know, pretty well known amongst the kids, the students, and most of them were American young people who had run away from the Vietnam draft. They had to come up to Montreal to avoid the draft. So they didn't have access to medical care, and Canada didn't have its healthcare system as we know it now. So anyway, I began seeing a number of young people. I learned a couple of things, and you know, there's always lessons to be learned. And I always say, if you could learn one thing every day, you've got a bunch of wonderful facts that you can use for the rest of your life. And after about a week there, I noticed there would be people, young people, who would sit in the waiting room. And when the clinic was over, they were still sitting there. And I would come out and I would say, is there anybody else to be seen? And they would say, no. And I would say, well, what about those two young people sitting over there? Oh, they just come here to sit. And then when the clinic's over, they leave. I thought, you know, I mean, why? And then I realized that these are young people who don't have any constancy in their life. They have no sense of safety. They're living on the streets. And this was a safe place for them to come and just be. They could sit there safely and meet people and talk to people, and then they could just leave. And that really reminded me that it's very important for young people, when I became more involved in high-risk youth, that there is some constancy to their life, that you give them some kind of safe place, which may be you in your relationship with them, or you in the program that you're working for with them to have this constancy.
But it wasn't so safe for you.
Well, no. Because I was doing this, and I was young, and I was, you know, a resident, one night in comes the police. Guns on their holsters, you know, and I'm a cop-fearing man, you know. I mean, I'm not a kind of guy who just brushes them off and say, oh, there's a police car. They came in, and I thought, oh, they're coming in to congratulate me or do something. Yeah. Yeah. And they came in, and they said, are you Dr. MacKenzie? And I said, yes. He says, well, we're here to close this place down. And I said, well, why? Because I was only altruistically doing good. And they said, well, you know, you're doing abortions here. I said, no, I'm not doing abortions here. They said, you're selling drugs here. I said, I'm not selling drugs here. They said, doesn't matter, we're going to close you down. So they, sure enough, next day went down, big lock on the door. Little apartment closed, clinic closed. Well, little bang, 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 long-haired kid somehow got them to open it up again. And I don't know how he did it, but the lock was off the door, and next thing, 2 weeks later, he calls me up and says, clinic's open, we need you. So back down I went again and start seeing the kids, and sure enough, after 2 clinics, in came the cops again. And this time they really threatened me. They said, you know, if you continue to do this illegal activity, we are going to arrest you and put you in jail. All I can think of is, what is my chief of service going to think up at the hospital? One of his residents is now in jail. Yeah? That's all I can think about. Not about me. I was just thinking, you know, what about my future? So anyway, it ends up that this young kid knew somebody who was on the board of a local settlement house, who was well connected with a lawyer who said, go ahead and open and he arranged somehow for the clinic to be open. When they closed it again the second time, this guy who was a sort of a leader in the Montreal community went to the mayor and told the story to the mayor, and the mayor believed him because he was a credible individual. And next thing I know, the clinic is open again, and I've got the Rotary Club coming down. Can they paint the place, you know? You know, can they hang pictures? You know, we have somebody who's a drug rep. Can they bring some drugs to you? And next thing you know, I'm nominated to be Canada's Outstanding Young Man. So I'm chosen the next year as Canada's Outstanding Young Man. I'm on national television, you know. The Governor General of Canada has given me this award for all of my outstanding activities. I just kept saying, I wish they knew the truth, you know. and so from there on, I came back, and I'm now in my senior year of my residency. I said, and you know, I'm touted as sort of a leader in providing medical care to teenagers, to adolescents. I knew diddly squat. I still have my pocket of questions with me. So I thought I better come down and learn something about adolescent medicine. So one night in the library, after admitting a very sick patient who was septic, waiting to see if the antibiotic was going to take effect, I went down to the library and I was flicking through, and I saw the Journal of Pediatrics, which I never read pediatric journals, and they had, you know, Fellowship in Adolescent Medicine in Los Angeles. Oh, I said, that sounds like what I want to do. So I went to my map, and I had never left Montreal. I went to my map to see roughly, not exactly where Los Angeles was. And then I looked up where the hospital was, and I thought, oh, I could live in Malibu and then come to the hospital every day, and I could have this kind of California experience, you know? Well, of course, that's impossible, but anyway. So I applied, and sure enough, I got chosen to go to Los Angeles as the fellow. By this time, I was married, and we just had a new baby, and came across in my little Volvo P1800. My daughter was sleeping in a drawer from a bureau that we took in the back seat of the Volvo. And, you know, we drove across, and the hot weather got here, and about probably, I would say, 6 weeks after I arrived, I was told that the division director at the time was going on sabbatical for a year. Well, the division director was the division. I mean, there was no other faculty. He was the faculty. And so off he went to wherever, and I was left with a volunteer physician from the community, and Gloria Castle, who was half-time. Some of you know Gloria. Gloria Castle, who was half-time, as my preceptor. Well, what I did, and this is the next concept that I began to gather, is that, you know, I knew more about the contemporary issues of adolescence than they did. They knew a lot about diabetes and obesity and asthma and all of the, what I call the traditional issues of adolescence. But I came in with this hodgepodge experience of menstrual disorders. Pediatricians never talked about menstrual disorders. STIs, never talked about STIs. You know, we used to define a pediatrician as someone who's afraid of pubic hair. Yeah? And so they never talked about these things. And so, you know, I felt that, you know, when someone came to the hospital, you know, with a drug overdose, you know what they would do? 1969, 70, the emergency room? Call the police. They would call the police. And so the police would come, and they would take, I don't know what the police did with them, but they would take them away. And I said, that doesn't sound like the right. At least we had a little bit of common sense in Montreal, where we saw this more as a medical problem, at least the initial steps to deal with the drug use. And over that year, I really was left very much on my own, and I really, at that time, developed some leadership skills. Just to go back, 1968 was the founding of the Society for Adolescent Medicine, 1968. The Society for Adolescent Medicine was incorporated in California. Its head offices were in the division that I was now supposed to be fellow in, but somehow was more than a fellow. And what fell upon me was some of those day-to-day, it had been left in the hands of the division's secretary, division head secretary, who was excellent. She knew the ins and outs of how to get but you know, the membership of the society was 98. It wasn't a big society. You know, the meeting was